Are you suffering from knee pain with tightness and weakness due to osteoarthritis? Hi, my name is Annie. Welcome to my channel, Annie Pilates Physical Therapist. In this video, I'll be discussing about knee osteoarthritis, the symptoms, and how to help strengthen the muscles surrounding it, utilizing elastic band, pillows, towels, and belt, utilizing physical therapy and Pilates. So get your mat ready and join me. Knee osteoarthritis is very common, especially as people age. It happens when the cartilage that cushions the knee joint starts to wear down. That can happen as you get older or because of an old injury or other stresses on the joints. It could start to have bone spurs, and if you lose that cushion, it starts to have this irritation around the knee joint, the capsules, even the bursa behind your knee. And that's what we call knee bursitis or Baker's cyst. And if you have the symptoms, having this swelling, because there's not enough supporting your structures surrounding your knee, so the best way is to slowly introduce gentle strengthening exercises to support your knee. Although there's no cure, you can treat the pain. Your doctor may prescribe painkillers, and sometimes for long-term use of drugs can lead to serious side effects. The next step, usually the doctor will do some injections surrounding the knee, such as steroids injections, and if it gets really worse, physical therapy is the next step, and that's why I have this video. My best recommendation is to still see your local physical therapist to evaluate your knee before you start any exercise program. I also recommend to put some ice and heat surrounding your knee before you start treatment, and rest and pacing and energy conservation techniques is also the best way to help slowly strengthen your knee. Researchers are also looking new ways to treat. Some of the methods they're trying to include are doing some injections, PRP injections, as well as stem cells and bone marrow aspirate constantly. However, if you don't have access on these, as well as Botox injections or ablation, then the last resort will be, if you're bone-to-bone on your knee, is knee replacement. And usually that's very painful and the recovery is difficult. Once you find the right doctor, usually you can get best results as you go through this procedure and making sure you follow through with a physical therapist. But in this video, I'll show you how to help decrease the pain and inflammation as a way to help cultivate cartilage and support surrounding your knee. The muscles that we are targeting today are your hip adductors that helps your inner side of your knee, the hamstrings muscles, the muscles that you'll find behind your knees, from your hip all the way down behind your knee. And the last group of muscles are your quadriceps muscles, which are the muscles that support your knee in front, on the front of your thigh, to help you get up and down the stairs so you can extend your knee without pain. So let's begin with the exercises. The first exercise will be targeting the quadriceps muscles. It's a long muscles in front of your thigh that is involved in straightening of your knee and in part to flex your hip. They are responsible for controlling your kneecap. They are used in walking, running, jumping, squatting, getting out of the chair or the car, and climbing stairs. This exercise helps to improve the local strength around the knee joint and kneecap. So we'll begin lying on your back or sitting up and place a rolled up towel underneath your knee. If lying on your back is easier, then you can prop some pillows and lie down. But if you can sit up straight, then that's great as well. Place the rolled towel underneath your knee, draw your toes up towards your head and press your knee into the towel. While still pressing your knee into the towel, lift your heel off the floor or bed. Hold for 3 seconds and repeat 10 times, or slowly build it up to 5 to 10 seconds hold, or otherwise prescribed by your treating physiotherapist. Precautions is ensure you press the knee into the towel and feel the front of the thigh engage. Stop if you feel pain or unsure of the technique. It's best to still speak to your physical therapist if you have any concerns or questions, or leave a comment down below and I'll try my best to answer each one of you. It's also best to engage your core muscles by doing deep breath as you inhale and gently exhale and squeeze your knee and engage as you breathe out. My recommendation is to do this 10 repetitions and progress to 3 sets of 10. As you inhale, squeeze down. Tighten, engage your core. As you breathe out, relax and lower your heel down. The next exercise is short arc quads. You will need 2 pillows or a bolster. Short arc quad exercise is a physical therapy exercise that is often used after a lower extremity injury to strengthen and improve neuromuscular recruitment of your quadriceps muscles. Learning how to do it and performing it properly can help you have a seamless rehab from a knee or hip injury. To perform the short arc quads, follow these simple directions. Lie on your back with your knees out straight. Place a bolster under the knee of the quad you wish to strengthen. You can use household items like a coffee can or a basketball as a bolster, or you can use prop-up pillows. Slowly straighten your knee until your leg is fully straightened. Maintain contact with the bolster at all times during the exercise. Tighten your quad muscles. As your knee straightens, you should try to straighten your knee out all the way. Hold the knee position for 3 to 5 seconds and then slowly return to the starting position. You should repeat the exercise for 10 to 15 repetitions, performing 2 to 3 sets. The short arc quad may be recommended to maximize the challenge to your quads. You can also increase the intensity of the exercises by placing 1 to 3 pound cuff weights on your ankle when performing the short arc quad. To progress work on your quads and hips, you may wish to perform the straight leg raise exercise progression after doing this. Inhale, squeeze and tighten. Exhale, relax, lift 6 inches off the mat and exhale down. Inhale, lift. You can start 1 to 2 seconds and then exhale. The next exercise is hip adductor squeezes. You will need a pillow or soft ball to utilize on this program. You're going to place the pillows between your knees. You can use 1 pillow or 2 pillows, whichever you're comfortable. Squeezing between your knees hurt, you can place it between your feet instead. So with this, do not squeeze to excess. It is possible to cause pubic symphysis pain with this exercise. You want to make sure you lie down in relaxation position with a pillow between your knees and your feet together on the floor. As you breathe in, wide and full, zip and engage the pelvic floor muscles, maintain pelvic neutral. Breathe out and at the same time squeeze the pillow as hard as you can. In this exercise, we're targeting your hip adductor muscles that I described earlier. Now breathe normally, hold for 5 to 10 seconds, maintain pelvic neutral, keep upper body relaxed. You can repeat this exercise 10 repetitions and gently progress. The harder you can zip and engage the pelvic floor and bring your navel to your spine, the greater the benefit. Don't squeeze the pillow too hard, too fast, and do it gentle, isometric, no actual movement exercise when you hold. This exercise strengthens your inner thigh. It's a great preparation for horse riding, skating, and sports requiring leg agility. The inner thigh adductor muscles anchor the hip joint in its socket, and it's stabilizing the sacroiliac joint and helps support your inner knee get re-inflamed. You want to maintain pelvic neutral, keep your upper body and arms relaxed if it's possible, and you can gently progress utilizing your hands, opening and closing as well, to fully engage your muscles. If you have your buttock pain and a lower back pain related to this exercise, then I recommend to do this slow and steady and gently caution what's best for you. The next exercise is straight leg raise. Need no special equipment to do a straight leg raise other than the space where you can lie on your back freely from start to finish and easily perform with other complementary exercise 3 to 4 times per day. It is often better to do the straight leg raise on a carpeted floor than a soft bed. Soft surfaces can compromise the position of your hips, allowing them to twist or sink rather than remaining the neutral spine. To start the straight leg raise, lie on your back with your hips square and your legs laid out comfortably on the floor. Bend the knee of your non-injured leg at a 90-degree angle, planting the floor flatly on the floor. Stabilize the muscles on your straight leg by contracting your quadriceps. Inhaling slowly, lift the straight leg 6 inches off the ground. Hold for 3 seconds up to 5 whenever you feel stronger. And then exhaling slowly, lower the leg to the floor with control. Relax and repeat 10 times or more whenever you're ready. When done correctly, you will feel the tension in your hip, thigh, and abdomen throughout the movement. If you engage your core muscles, that would be great by pulling your belly button in towards your spine. To make the straight leg raise more challenging, add a small cuff weight to your legs. Start by placing the weight on your thigh, lowering it to your ankle as you get stronger. This helps to decrease torque around your hip and knee and protect them from injury. This straight leg raise can be challenging but should not cause pain. If it does, stop and call your doctor or physical therapist. Until you are stronger, you may have to perform different exercises that don't stress the hips so directly. Inhale, lift, and exhale. The next exercise is hamstring stretch. The next exercise is this hamstring stretch. You can utilize a yoga strap, belt, or elastic band. The elastic band will help strengthen the hamstrings in eccentric control. So in this exercise, you lie down on your back with one leg stretch. Place the strap around the arch of your foot. Begin by lying on the back, legs extended and chin tucked in. Place the strap onto the arch of the foot. Inhale as you slowly raise the foot up towards to the ceiling, keeping the other leg connected and down towards the floor. Grip the strap with both hands and only go to the point where you feel the first initial stretch in the hamstrings. Flex the other foot and contract the quadriceps muscles. Stay here for 5 to 10 deep breaths and repeat on the other side. This increases the flexibility of the hamstrings and calves. This prevents a lot of pain and it helps the swelling behind your knee. You can hold it further up to 90 degrees, and as you lower it down, gently tap the mat. You can also challenge by holding that elastic band as you lower it down, feeling the eccentric control resistance behind your thigh to strengthen your hamstrings and lengthening it at the same time. So as I lift up, inhale, pull with my band, dorsiflex your foot, pull more further to challenge, and you can do gentle ankle pumps to further stretch your calf and hamstrings together. At the same time, strengthen your ankle muscles. And slowly let go and exhale. Next exercise is ankle eversion and hip external rotation. This will help open your hips out to stabilize your knee as you walk. And you have stronger ankles, you'll have better stability on your knee. So you're going to place the strap around your feet and gently separate your toes and feet as you slowly engage your hips as well. Slowly open your knees and your hips out. Hold that for 5 seconds. Hold. Engaging your core and gently progress up to 10 seconds. Hold. 3 sets of 10 as you get stronger. The next exercise is butterfly. Butterfly helps external rotate and abduct your hips, and this will help stabilize your knees as well. You will need a strap around your thighs. Gently separate your knees out as you inhale and then exhale, going back in, still engaging your core muscles. You can slowly start 1 to 2 seconds hold and gently progress to 5 to 10 seconds hold. Do 10 repetitions. As you get stronger, do again more sets as you get stronger. 10 seconds hold if you get stronger on your hips, and this will help support your knees for better stability and control. Inhale and exhale, back send. Inhale as you open, squeeze your core in, and exhale, back send. The last exercise is clamshell. You will need a pillow between your knees. If you have a lot of swelling, that will help support your knees. And again, strap around your thighs the elastic band or a belt. So slowly place the pillow between your knee with the elastic band. Gently lie on your side and use a towel to hug between your arms for better support on your spine. Keeping your spine in neutral position, try not to lean back, not to overarch your spine as well. As you slowly lift the top knee without twisting your spine, keeping your core engaged, and hold that for 5 seconds hold for beginners. And if that's still too difficult to hold, you can start 1 to 2 seconds, and then gently progress to 10 seconds hold, 3 sets of 10. As you breathe in, out, lift, engaging your core, and exhale as you go back down. And if you want to engage your hip adductors, you can also squeeze the pillow between your knees for dual purpose of strengthening your hip adductors and abductors. So inhale, exhale, squeezing your core in. You can end the program with some ice for 20 minutes to cool down. And that's it. I'm hoping you learned a lot from this video. If you find value, please subscribe to my channel, ring the bell so you won't miss anything, like and share this video to your friends and loved ones, and to support my channel. Until my next video, always remember, be safe, be well, and healthy you. Bye!